Paying attention to health and your dental hygiene, especially your gums, may pay you back with more than a gleaming healthy smile and affordable health care bills. It could keep your heart healthy also. Nevertheless, experts stress the key word is may. Periodontists and cardiologists have long debated the connection between dental health and cardiovascular disease. The issue still is not completely resolved, says Robert Bonow, president and chief of cardiology at Northwestern University's Feinberg School of Medicine. It isn't clear whether gum disease actually has a direct connection to cardiovascular disease, Bonow says. There are threads of evidence, but they are really not yet tied together. If people with poor oral health experience more cardiovascular disease, it does not mean poor oral health leads to it. Individuals with good oral hygiene may just be taking better care of themselves. Quite simply, individuals who floss and brush their teeth and follow other heart-healthy habits may also exercise regularly. Gum disease and heart disease, how could they be linked? Pros do agree that there are plausible reasons why heart health as well as dental health could be intertwined. For instance, inflammation is a typical issue in both ailments, Bonow says. Hardening of the arteries and plaque buildup are both inflammatory processes. Gum disease also has an inflammatory process, says Sam Lowe, Associate Dean at the University of Florida College of Dentistry. Gingivitis, the beginning phase of gum disease, occurs when bacteria overtake the mouth and gums become inflamed. Research shows about heart and gum disease. Specialists in cardiology and periodontology lately reviewed more than 120 published medical studies, position papers, and other data on the link between dental health and one's heart. They developed a consensus report. The goal was to give health professionals an improved knowledge of the connections between gum disease and heart problems, but much of the info is helpful to consumers also. These points are made by the report. A review of numerous published studies finds that gum disease is a risk factor for coronary artery disease. Analysis of the large National Health and Nutrition Examination Survey found that gum disease is an important risk factor for diseases of the blood vessels and arteries that supply the brain, especially strokes involving insufficient blood or oxygen to the brain. Data from another study of over 50,000 people found that those with fewer teeth and more gum disorder had a higher risk of stroke. Other research found a direct link between clogged arteries in the legs and gum disease.